Good afternoon, everyone. Today we are going to start with the horizontal jaw relation, that is also known as centric relation. Okay. In last class, we discussed about the various types of jaw relation and vertical jaw relations. Today we are going to start with the next topic, that is the horizontal jaw relation. So basically, as the name indicates, it is the relationship of the mandible to the maxilla in the horizontal plane. Okay. Now we are studying the horizontal jaw relation. So basically, we have to classify. Again, it is classified into two categories, two classes. The first one is your centric relation, and the second one is your eccentric relation. Again, the eccentric relation is again classified into protrusive and the lateral relations. That can be a right lateral and the left lateral. Okay. The definition of the centric relation is very important for you guys. Okay, it is one of the important definitions in prosthodontics. Okay, it is defined as the maxillomandibular relationship in which the condyles articulate within the thinnest avascular portion of their respective disc. Okay. So basically, it is the relationship of maxilla and the mandible. We have the condyle which is articulating into the fossas of the respective disc. So basically, it is in the thinnest avascular portion. So the position of the articulation is in the anterior and the superior position against the slopes of articular eminence. So basically, suppose so basically this position is independent of tooth contact. There is no tooth contact in the centric relation. The position is clinically discernible when the mandible is in the direct superior and anterior position. So it is purely rotary movement about the transverse horizontal axis. So basically there are various methods to record your centric jaw relation. The first method is physical method, then comes the functional method, graphic method, and radiographic method. There are four definitive methods to record your centric jaw relation. The most commonly used method is your functional method that you use in the physical method that you use in the clinical practice. Okay, now we will learn each and everything one by one. Okay, the tactile or the interocclusal check method. It is the first method which is comes under the physical method. Okay. This is basically depending upon the tentative jaw relation is taken for your centric by asking patient to retrude the mandible most posterior position. Okay, we'll ask the patient to retrude the mandible posteriorly and take the centric in a tentative way. Okay, it is not the accurate method to record the centric occlusion. Okay, so basically this steps involve the procedure of it. So basically, first what we do, we do record the tentative jaw relation with the help of your wax ring and take a check record of the same with the help of your waxes or other vitalization materials. The next method is the second method, that is your tentative jaw relation again. So the maxillary wax ring is inserted into the patient's mouth. We check the vertical dimension at occlusion and the rest. Okay, after establishing the vertical dimension, we ask the patient to retrude the mandible or we guide the mandible into the most posterior position. Okay, after guiding the mandible into the most posterior position, we seal the occlusal wax ring in the same relationship. Okay, and transfer it to the articulator. Now, how to make the interocclusal record or the interocclusal check record? Now, what we do basically, after inserting the upper and lower maxillary and mandibular wax stems, we ask the patient to close the mandible when we are placing the cotton in between your upper and lower bite ribs. Same thing is replaced with the help of your occlusal wax, that is wax can be used to record the occlusal surface of the teeth in the mandibular rim. So basically we just retrude posteriorly and it closes the patient closes the mandibular rim onto the maxillary rim with the help of your wax. Now we ask, wait for some time to get your wax cooled down for some period of time. Okay. After that, we articulate it to the cast and say the next design will be carried on with the same. The next method is your static method, or that is also known as the pressureless method, or it is also called as Nick and Notch method, which is commonly used in your dental clinics. So basically, it is the final centrifugation which is carried out after establishing the vertical jaw relation. Each and every method is done after proper recording of your vertical jaw relation. Now come to the procedure. Same thing is carried out, which was done in your tentative jaw relation. The same thing is again done for your Nick and Notch method. But the next thing is you have to remove the 3 millimeter of wax from the either side of your mandibular wax rims in the premolar and the most distal end of your depression, that is called as trough. Okay. Now this is your mandibular wax ring. We create a trough in the mandibular wax ring. Okay. That will be around 3 millimeters in depth. Now we have to give the 1 or 2 notches cut which is present on your maxillary wax ring, that will be in the V shape. Okay. We are creating a valley which is running through across the width of your wax ring, through and through. Okay. After that, you can see it here. This is anteriorly and this is posteriorly. This is a through and through valley which is created, that is V shape, into the maxillary wax ring. This is in the anterior position, just a nick present in the anterior part, that is in the premolar region. Okay. Then we place the wax rims into the patient's mouth. We ask the patient to retrude. Again, we guide it in the retruded position. We place the aloe wax. We soften the aloe wax and place it into the trough. In this trough, we place the aloe wax. Okay, aloe wax is placed here. Then we guide the mandible into the most posterior position and seal it accordingly. So after that, after the sealing, all the maxillary and mandibular ribs will be sealed it here again, and same record will be transferred to the articulator. Okay. Next comes the functional method. In functional method, basically, there are 2 methods. The first one is needle house method. In needle house method, what we do basically, it basically requires fabrication of the rims with the help of your impression compound. We use impression compound for the fabrication of wax rims for your needle house method. Okay. We add 4 metal bits which are embedded into the premolar and the molar region into the same wax rim. Okay. So this is your maxillary wax rim. We have the 4 embedded metal balls or the styli present on the premolar areas and the molar areas. Okay. Then we place the mandibular wax rim into the patient's mouth. We ask the patient to do the mandibular movements. Okay, protrusion and the lateral movements of the mandible is done. Okay. After that, we ask the patient to do the movements. After doing the movements, we get a diamond mark like this onto the patient's mandibular wax rim. Okay. This is the centric relation point. Okay. This is the left lateral, right lateral. Okay. This is the protrusion position. Okay. First patient do the protrusion, then the lateral methods, that is the lateral side on the left and the right. So we get this diamond type of shape on marking on your mandibular wax rims. Okay. Then we guide the patient in the centric and seal it. We ask the patient to retrude in this position and seal the wax rim. Same is transferred again onto your articulators. The next method is your graphic method. Okay. Graphic method can be done with the help of 2 methods, this intraoral and extraoral method. Okay. For that, you require arrow point tracing and the pantograph. Okay. For intraoral arrowhead or the traces, basically is done with the help of your point traces, and same for your extraoral traces also. So basically, in intraoral traces, one of the dimension, it is one of the graphic method to record the centric. Okay. We are using graphic arch traces on the mandibular and the maxillary arch. So basically, we have the centric bearing device present for your recording of your maxillary and mandibular rim in the centric position. So basically, this device has the 2 parts. The first part is central bearing point, and the second part is center bearing plate. So basically, this is the plate which is fixed on the maxillary arch. Okay. So basically, it is fixed on the maxillary arch, and this is the centric bearing device, complete plate, and the pointer. Okay. So basically, this is will be in the maxillary arch. Okay. This will be on the mandibular arch. The procedure for the same is for the same. So basically, we start with the attachment of the central bearing point and the central bearing plate to the respective maxillary and the mandibular maxillums. After that, what we do? Basically, after that, we start with the central bearing point, which is adjusted in such a way that it will be in contact with the central bearing plate in the center. Okay. The contact is adjusted, the vertical dimension is checked. We'll ask the patient to close the mouth again. After that, we will ask the patient to contact the metallic plates together. The patient will do the anterior and posterior movements and the lateral movements are performed. After performing the same thing, we get arrowhead tracings on your mandibular areas. So this is present in the mandibular arch. Okay. We get this arrow point tracings. This will represent the same thing. This is the your centric position, left lateral, right lateral, and this is the maximum protrusion. Okay, which was earlier present in this slide. Okay, same thing. This is the protrusion. Okay, this is the arrowhead which was present in the intraoral traces. This is the maximum protrusion. This is the centric relation, which is this point. Again, left lateral and right lateral. Okay, same thing is done on the with the help of a blunt apex, centric apex, which will give you this type of relation, but it will be an improper tracing. Your tracing should be like this, okay, not like this. Okay. Now come to the extraoral. Now come to the extraoral arrow point tracings. The first in the extraoral tracings, the procedure is basically similar to the intraoral traces, but the attachment of the devices is exactly opposite to the intraoral devices. In extraoral tracing, basically, when you want to place the central bearing point, it is placed in the maxillary, exactly opposite to your intraoral traces. The difference is the recording plate is present outside the mouth. Okay, this is the plate. The central bearing point is present in the maxillary tissue. So basically, we ask the patient to perform the same movements, that is protrusive, lateral, and the anterior posterior movements. We'll record the same areas again. We get the arrowhead tracings like this again. Okay. This point will be a centric relation. This will be a left lateral, right lateral, and this will be a maximum protrusion. Okay. And the eccentric movements, all the movements which are present other than your centric are called as eccentric movements. Okay, that can be your protrusive and the lateral relations. Okay. So basically, we don't record these movements. Okay, this is not present in the patient's mouth. So basically, this concludes the topic. In this topic, basically, we should know the different types of classifications of a horizontal relation. That will be your centric relation and the eccentric relation. Eccentric can be your protrusive and the lateral relation. The definition should be by heart. This is the half definition. This is the complete definition. You have to by heart till this point. Okay. So basically, it is the maxillomandibular relationship. So again, in definition, what we have to learn. So suppose this is your head of the condyle. Okay. This is your fossa. Okay. Temporal fossa. So basically, your head of the condyle, it is articulating in the thinnest vascular portion of your disc. So this is your disc. This is the cartilage present in between. So basically, your head of the condyle should be present in this area, not most posterior position, not retrograde position. Okay, this is the most important position. Can be repeated by the patient. Okay. So the slopes of the articular eminence. This is the slope of the articular eminence. The position of the your articular disc should be in this anterior and the superior position. So basically, this is the most important part. It is independent of full contact. Okay. The methods of the jaw relation. You should know in detail about the neck and notch method, which you use in the clinical practice in your department. Okay. So basically, we make a trough on the mandibular vein, okay, which is around 3 millimeters depth. Same thing on the maxillary, V-shaped notch in the anterior and the posterior. The posterior notch is running through and through across your maxillary. Okay. Then we place the occlusal uh, check bite or the wax in between two wax rims and ask the patient to guide. There are various materials which can be used uh, other than wax is your zinc oxide ethanol impression paste can be used. Again, elastomer compression materials can be used to record this. And the bite resistant paste can be used to record the same thing with the help of Allovax. Okay. The functional method is same. Again, it's very easy to remember also. So basically, in this triangle or the diamond shape, we have this part detects your maximum protrusion. The pass which is present most posteriorly will determine your centric relation. Okay. The graphic method is very difficult to understand. You don't do it basically. The postgraduate student basically do this to, but you, for the sake of writing, you have to understand it properly. So basically, we have the intraoral traces and the extraoral traces. The different parts of the arrow point tracing should be known to the student properly. So this is plate. This is your center bearing plate, and this is your center bearing point. The same is attached to your maxillary mandibular vaccine. You get the same arrowhead tracings as you get in the Riddle House, but it is not in the diamond shape. But it is in the arrowhead. It is the improper tracing which was done because of the blunt centric apex which was present for your tracing. Now come to the external arrow point traces. Same thing, external arrow point traces are present externally. Okay. But the internal arrow point tracing is more accurate when compared to the external. In external tracing, the centric bearing point in the plate is different from your internal tracing. It is exactly opposite to the internal tracings. So basically, its stylus will be there, which is attached to your maxillary vaccine, and the plate is on the mandibular vaccine. We ask the patient to do the movements, the protrusive movement, the lateral movement, and the anterior posterior movements to record the eccentric motions, and we get the centric relation, which will be around 6 millimeter from your protrusion. Okay. Now comes to the eccentric movements. The same thing is again divided into two categories: the protrusion and the lateral movement. We don't record this. Okay, we record this for the full mouth cases, not in the complete ranges. So this ends your topic. We covered the jaw relation in two parts. So basically, the only part remaining is your orientation jaw relation. Okay. In next class, we'll deal about the orientation jaw relation.